Hi, this is Ask Dr. Sampson Davis, where I answer all your medical questions. I recently received a letter from Barry, and Barry writes in, Dear Doc, my dad had horrible pain on his right lower side of his abdomen. We are so scared he is having appendicitis. What should we do? Should we have gone to the emergency department? His pain has improved, but it may come back. What do you think? Barry, I get it. I mean, I grew up in a situation where my mother had a remedy for everything. I had a cough, here's some tussin, here's some rub. Put the towel on my chest to draw out the cough. Oh, I have a pimple or an abscess, or here's some medication to help bring it to a head. She had a remedy for everything. And thankfully I survived. Thankfully my brother survived. So I understand the sort of let's wait it out and see game. But the truth of the matter, it could be appendicitis. And appendicitis could be life-threatening. It's 2 o'clock in the morning. Who wants to get out of their bed? I'm just going to wait till I feel better. Let me be tough. And so by waiting it out is not by being tough. That's not being tough. That's being foolish. I had a case where a 32-year-old came in with right lower quadrant or right lower abdominal pain, and it turned out he waited 2-3 days for it and grew into an abscess and it ruptured, and it almost took his life away. It almost killed him. Make sure that's not you. If you have pain, come to the hospital. That's what we're here for. Let me take care of you. Let someone in the department take care of you. Barry, this could be appendicitis. It could be other things, but it could be a life-threatening situation. Something that could be treated very easily with a very common surgery, small bikini scar. As for the young man who waited a few days to come to the hospital, we had to do a long incision, had to open him up. His cavity was full of pus and all blood and gross stuff, and spread into his bloodstream and called a bloodborne or a bloodstream infection called sepsis, and he almost died. He almost died because he called himself being tough and waiting it out. So let's not make that mistake. That doesn't have to be your reality. Barry, bring your dad to the hospital. Let him see one of the emergency room physicians there. Allow us to take care of him. And if for nothing else, if it's not appendicitis, at least you have a peace of mind. Make sure you do the right thing.